We're discussing virtual care and how that's being impacted by recent changes to the Ontario system for doctors' billing. And joining me again is Dr. Michael Verbora. Dr. Verbora, before we went to commercial break, we were discussing how billing can impact access and how virtual care and access to virtual appointments actually impacts greater those living in a rural environment, like myself, for example. I live in the country. We have very few specialists. There's always a desperate need for general practitioners. And I can say I definitely benefited during COVID to be able to access more healthcare virtually. Is that commonplace? If that's been your experience with your practice?
Yeah, so again, I've been doing virtual for 7 years, and the type of practice that I mostly do is counseling. So it's mostly long conversations about risks and benefits of different types of therapies in conjunction with other medications and altering medicines. I'm not doing a ton of what we call diagnostics. I think when you're doing diagnostics, you have patients with new symptoms and they need a workup. Being in person is definitely the better method. And that's probably from a safety perspective as well. But when you're having conversations, like, for example, mental health mostly or pain management mostly, that can be done virtually. It's very inconvenient for a patient have to drive 4 to 5 hours, lose a day's pay of work just to do, let's say, a 10 or 15-minute visit with a physician. And that's kind of, hits at a bigger issue in healthcare. And I was speaking to a colleague last night who's now leaving to the US because she's an innovator. And the challenge here in Ontario and many other provinces is it's so hard to innovate and provide efficiency in healthcare because the moment you do, the government comes and they start trying to cut your fees or slash your fees for that innovation.
Well, that sounds shameful to me. What you've just expressed, that's terrible. I mean, we should be rewarding those who do innovative things and want to be more efficient with healthcare delivery. And I think that's a good thing. I do agree, though, yes, as you suggested, for diagnostics. And obviously, it's good to have that in-person relationship. Sometimes doctors will catch things that you wouldn't self-diagnose. And that's important because they are specialists. They are trained specially in medicine. So we want that kind of expertise. And like we mentioned before, perhaps for those living in urban centers, this is a completely non-important conversations, but those living outside GTA, this could very well much play into how they receive healthcare going forward. So with yourself, because you've engaged in virtual care for so long, was there no way for you to be grandfathered in, for example?
Well, you'd think that they would try to grandfather people in, and they made exceptions to the addiction medicine for the people who are doing opiate replacement therapy. And there might have been one or two other small exceptions that have been kind of quiet or hush hush. But look, we've advocated through all the proper channels. I sit on the OMA committee for cannabinoid medicine, and I don't know if it's the stigma of cannabinoid medicine or what it was, but our arguments weren't getting through to anybody on the OMA side or the Ministry of Health side. And it's really unfortunate because my practice specifically, I have hundreds of children with pediatric epilepsy and autism. These are very highly sick children, and just if I could prevent just one of them from an ICU visit, that makes up more than half the amount of money they're going to pay me for the year. So it's just, again, short-sightedness. I really wish we would just allow and trust physicians and patients to make the best decision for when they should be in person, when they should be virtual. And that's a mutual shared decision that should be taking place. But when the government kind of sticks their nose in and says, sorry, we're going to force this a certain way, it ends up just creating a lot of problems for patients and a lot of problems for physicians.
So some of your patients, as you said, many of them are pediatric, are children. How have their parents responded to these changes?
Yeah, well, some of them are trying to figure out alternative ways. So we're trying to find doctors in their communities that might be able to do this work, but because it's so subspecialized, and I'm getting referrals from pediatric neurologists here in Toronto alone. So it's kind of a very, very subspecialized area of work. It just happens to be that I'm a family doctor. If I was a specialist, I'd be able to do this work virtually. So there's haves and have-nots in the system. So one, they have to either try to find a local doctor, or two, they have to either drive in person, or three, we have to try to accept some of them that are within a certain radius and just eat the 70% pay cut, which we can do the odd one. But you can imagine it's impossible to run an efficient business if you're taking a 70% haircut. Your rent is going up, the staff wages are going up, your fees for your electronic medical records are going up, your liability insurance is going up, your college fees are going up. So everything's going in one direction. The only way to keep the businesses running is to find efficiency, and then the government introduces more inefficiency.
My goodness. Well, it sounds like there's a lot of work that needs to be done in this department. Again, I was a great user of virtual healthcare, and even I can make a decision. Oh, I think I should see the doctor in person or not. But sometimes I had the physician saying, "No, you should come in person," and I trust their judgment. I'll say, "Yeah, no problem. Let me know, and I'll drive the 2 hours to Toronto or wherever it might be." So I do think that there is an importance that we must place to let the doctor make that decision. I mean, again, that they're specialists in their trained field after all.